Okay, well, we will keep moving steadily along here today. You guys know that we're going to cover clinician education training, and so we're going to warm up with a couple of questions that are here on the screen. These are questions that Baby Friendly will ask your staff, so all of your nurses and all of your doctors, when they come to designate you. And you can read it there. It says, why is it important that all women receive education about the importance of breastfeeding? So you can probably answer these because this is what you do all the time. You're on this call. But think about all of your nursing staff that deals with, or that gets to spend time with moms and babies, and all of your doctors, and see if they could tell you, for a designator, why it's important for all women to receive education about the importance of breastfeeding, and if they could all list at least 4 health benefits of breastfeeding. And those have to be specific benefits. They can't just say it's healthier for baby or it's healthier for mom. They have to give really specific reasons. So, because we're you know, a little short on time, and we've got a lot of these questions throughout the training. This one I'm just going to plant in your mind. I'm not going to go around the room right now and have you guys answer those, but this will just kind of just get you warmed up for some of the things that your staff is going to need to know, and that's why we're talking about training today. So at this point, I'm going to hand it over to Laura, and she's going to go through some of the nitty-gritty for training requirements.
Great. Thanks, Kirsten. Okay, so today, like Kirsten said, we're going to focus on the clinician training needs, and we're really going to focus on the Baby Friendly USA specific requirements. This is a good place to start because a lot of these hospitals, if you're not on the pathway already, it's something that's kind of in the back of your mind as something that you'd like to do in the future. So we want to make sure that any work you do now is going to count towards becoming baby friendly when you do enter the pathway. So if you're currently not on the baby friendly pathway and you're not moving towards designation, this is a good time to just think about what areas there are in your hospital for urgent need of education. So like, what staff do you want to prioritize training now, even though you might not have buy-in to train all of the staff that would need to be trained if you are going baby friendly. So what can you do now, and who needs to be trained the most? And so this webinar, again, we're going to focus on the baby friendly requirements. We're going to focus on some CHAMPS education resources, so some things that you can have as a CHAMPS hospital available to you to help you educate at least some of your staff now. And then we're also going to help you make a plan of what you can do in the next few months. Okay, so here is just an overview of the clinician education requirements. So Baby Friendly requires you to train clinicians who have contact with moms and babies between the time mom comes in labor to when she and baby go home. So this is, and then they divide your staff and those clinicians into 3 different groups. So there's the nursing staff on maternity, and they have a 20-hour training requirement. And for a lot of you guys, this is you've probably heard this from us before, but I just want to review all of this so we're all on the same page, and because it can get a little confusing as well. So you have nursing staff, which is the 20-hour requirement. You have doctors, midwives, and advanced practice nurses, and they have a 3-hour requirement. And then there's kind of this group of other healthcare staff in contact with pregnant mothers and infants. And so they need to be trained in order to do their jobs. So the facility determines how much training they need depending on what their job description is. For Baby Friendly USA, there's no required training for clinicians who only work in prenatal and they don't attend birth or see the baby when mom and baby are hospitalized after birth. And then you can only be responsible for directly training those who work for you. So this really comes into play with your doctors, your midwives, and your advanced practice nurses. If they are not hospital-owned physicians, then you can't require them to do the training, but you can encourage them to do the training. And we would encourage you to encourage them to do so. Okay, so we're going to start with that nursing requirement for Baby Friendly. So this is the 20-hour nursing requirement. And I just wanted, there's a note at the top of your screen that says to refer to Section A of your CHAMPS Clinician Training Plan. So this is one of the documents that I emailed to you yesterday, kind of as a way to prepare for this workshop. So this is the training plan, and if you were able to print it out, now would be a good time to kind of take it out and look at it and jot down a few notes to yourself as we're going through these requirements. So do most people know what I'm talking about, or are there any questions right now? I'll take that silence as that everybody knows what I'm talking about and they're following along. So great. So the 20 hours of training required of nursing staff is divided into 15 hours of didactic training and 5 hours of hands-on clinical skills training. So the 15 hours of didactic training, there are different options for you for completing that training for nurses. So there's kind of like an in-house option. So this is teaching your nursing staff at your hospital all of the 15 hours, and they would be taught by a lactation expert on your staff. So if your hospital doesn't really have a lactation expert, usually an IBCLC on staff, then this wouldn't be a great option for you. But if you do have an IBCLC on staff and that person is interested in teaching and educating their fellow nurses, then this might be an option you'd be interested in. And you would want to refer to Appendix A of the Baby Friendly USA Guidelines, which outlines all the 15 hours. There's a topic per hour, and then there are different objectives that you have to teach for each hour as well. So it's very specific, the education that needs to go on during the 15 hours. Another option is using an external training company or an external trainer. So this, you might hire a trainer to come and teach at your hospital, or you might hire a training company to come and train your staff, or you can there are some trainings where you can send nurses to a training program, and then they would travel and be trained and then come back. The third option is an online learning option. And so I've listed a few different online training options on this slide. So we have LER, which is Lactation Education Resources. They have a 15-hour course. There's Cofective in Louisiana. They have an offer a 15-hour course. And then there's also Step 2, which is another online course available to hospitals. So those are kind of like your three options for completing your 15 hours of didactic training for your nursing staff. When it comes to the 5 hours of clinical hands-on skills training, there's not an online version for that, because it really is, hands-on training. So you'd want, doing it online is not going to be sufficient. So there are two options. So you have an in-house option. So you'd have, again, if you have a lactation expert on staff, that person would be able to teach these hands-on clinical skills. And all the skills are outlined, again, in the Baby Friendly USA Guidelines. Another option for the 5-hour training would be an external training. So you'd have a trainer come from outside and train your staff. And here we have listed, we have the CHAMPS 4-hour clinical skills training. So a lot of the Mississippi hospitals probably know what we're referring to here, but their CHAMPS team members can come to your hospital and you can host a 4-hour clinical skills training, which would fulfill the 5-hour requirement. So again, this is for 20 hours total for nursing staff. Okay, so this slide just outlines what resources CHAMPS offers hospitals to help them to complete the 15-hour requirement. So as CHAMPS hospitals, we offer you guys 10 free slots each for the 15-hour course, which is offered through Lactation Education Resources. So how many people have accessed the LER course already? Have most people accessed the course?
We do here at Anderson's. I think we've enrolled our 10 free that we were able to get, and I think everybody but one has completed it, and she was out on maternity leave. So, yeah.
I don't know where we are on completion. This is Memorial, but we have staff that are working on it.
Great. Well, if you haven't signed up, we can help connect you to afterwards if this is something you're interested in. And we'll be planning, we'll talk about this more a little bit later in the workshop. So I also just want to note that LER will provide additional slots for all CHAMPS hospitals at a discounted rate of $45 each. So I think if you were just a person, an individual going to LER and you wanted to pay for this education, this 5-hour education, it would be over, I think it's over like $100 per person, but luckily because CHAMPS was able to negotiate this discounted fee for our hospitals. So that's good too, and something that you can kind of tell maybe your hospital management that, you know, this is a special offer, you get a discounted rate, and maybe that will help convince them that they should take advantage of this course. Okay, so here's, this slide just outlines the CHAMPS resources available for completing your 5-hour requirement. So we have the CHAMPS 4-hour clinical skills training, which it's usually taught by Kathy Carruthers, or you might have had Tawanda join her, or Kimmery Bug, or Cami Goldhammer join her. And so CHAMPS will come and do an on-site training. And so it's a 4-hour course, so it's a 4+1 method where CHAMPS comes and does 4-hour hands-on training, and then the people who attend are expected to go back to their hospitals and complete the last hour working directly with patients, practicing their skills, the skills that they learned during the 4-hour training. And we also offer a train the trainer as well for people who are lactation experts at your hospital if they want to learn how to teach this 4-hour course themselves. There's a webinar that they can watch and they can get all of the materials that CHAMPS has developed to then use at their hospitals to help train the rest of the nurses that need to be trained. So that's really great. We also have a fun idea. This is from Emily Taylor, who's probably worked with you on your electronic medical records. She gave us this idea of using a safety pin and beads to track competency completion. So each bead represents a different competency skills, and as your nurses, they come back and they complete that last hour of training and they practice all of their skills, an IBCLC would check off and make sure that they would sign them off on their competency sheets and say, yes, you know how to teach moms about hand expression, and then you would get the yellow bead, and you would go along with each of the different competencies, and eventually you would have all of the beads that you needed. So it's kind of fun. You can use this pin on your uniform, and like nurses might look at one another and say like, hey, I don't have my purple bead yet. I want that. And it's also a nice visual way of keeping track of who's completed the training and who still needs their competencies verified. Great. So let's take it. I just wanted to take a moment and just plan kind of some ideas for how you could complete your 15-hour trainings and what steps you could take at this time to get nursing staff to complete their 15 hours of didactic training. So it might be different if you're not on the pathway. You might not have buy-in to train all of your staff, but now's a good time to think about how you could train some of your staff. And then if you are on the pathway, you would be kind of planning out how to train all of your staff. So it's important to think about whether or not you've taken advantage of the free LER slots. And we heard from Anderson and from Memorial that they have. Any of the hospitals who haven't, definitely reach out after the workshop to me or to Kirsten, and we can help to connect you with LER. And then I was interested in just hearing some of your ideas for training staff beyond the free slots in LER. Have any hospitals started to think about what might work for them?
Actually, this is Angie. I've moved my primary lactation counselor to the full-time day shift. I had to fight City Hall downstairs about that because some days we don't have breastfeeders, but when she's not doing callbacks and breastfeeding education, she's out there actually training my staff. And I have a lot of naysayers that have been worried that my biggest issue, and Kathy did our training and my nursery nurses that have always been nursery nurses, and they're also worried about, I'm going to lose my job, I can't do labor, I'm not going to go on that side, da-da-da-da-da. But having her on the day shift has been so much better for us in kind of educating that staff and making sure that they understand that actually we're going to need you more because you're going to have to be going to the rooms and that sort of thing. And so it's helped with that, my older bunch that's been really kind of negative in the background saying this ain't going to work and, things like that. So that's been a positive for us.
Great. Has she been able to go through and verify some of the skills for the staff who were able to attend Kathy's training?
Yes, she has. And we also went to the one that you get the beads, and she came through with that. And it was so funny yesterday, as a matter of fact, we had a girl that came back that was severely engorged. She had said she was going to bottle feed while she was here. Then we kept hitting her with it and hitting her with it, even though we were helping her with proper formula preparation and that sort of stuff. But the day shift, most of us have attended all the meetings, and I've got to say I was one of those people that I wasn't breastfed, so I was thinking this doesn't have to happen and give them a bottle if they're going to be that way. But after coming to Kathy's training and the one that Kim Marie had in Jackson, it was amazing. So it kind of broke me into it as well. And this girl was severely engorged yesterday, and my nurses actually went in and showed her how to hand express and things, and it was really one of those star moments for me because they could all do it, and that's some of the stuff she's been helping them with and training them with. So that's worked out real well.
Great. Thanks, Angie. Yeah, that's a good example of completing the 5-hour competence clinical skills training. That's great. I think that's a good place to start, too, like maybe if you don't have buy-in to do the big 15-hour training, just to get that 5-hour clinical skills training down for your nursing staff so they can do things like help moms with engorgement. That's definitely important. Any questions about the 15-hour training before we move on to planning the 5-hour training?
Not here.
Oh, hi. You have a question?
No, I said not here. We were good.
Oh, okay. Great. Well, if you end up having any questions after the workshop, feel free to reach out to Kristen or to me. We're happy to answer questions. Okay, so now talking about planning the 5-hour training, this is kind of like what Angie was talking about at their hospital. They've done a lot of training for their nurses and they have a lactation expert who's helping to train nurses on the floor every day. So we just wanted to put these ideas in your mind of maybe hosting a CHAMPS 4-hour training if you haven't already, and then also thinking about if there's someone on your staff who could conduct the 4-hour training at your hospital. So if anybody, does everybody know where to sign up for the 4-hour trainings on our website? I'll take silence as you do know where to sign up. Are there any questions for you guys at this time about how you could complete your 5-hour clinical skills training, or barrier, you know, maybe you see some real barriers and you'd like feedback from other hospitals about how they've overcome these barriers?
I'll ask a question. This is Amy at Memorial. If we've already had one 4-hour training, is it ever possible to have another one later down the road? We had a large number of people. I can't remember how many we had. We had about 50 that attended.
Yeah, so it is definitely a possibility, and if there's a need at your hospital, then let us know that you would like an additional training. I think one important thing to think about too is if you have, if there's someone on your staff who could do the training in the future, because that would be a good time. Maybe the second, and Kathy's done this at trainings, during the second training, she'll have that staff member from your hospital really help her during the training. So that person will get to train alongside Kathy and start to feel a little bit more comfortable about doing the 4-hour training, maybe on their own in the future.
That's good.
Yeah, Amy, is there somebody at your hospital who would be a trainer?
Probably Tina. Tina, hello, you on the phone?
Okay, well, yeah, so if Tina would be the trainer, then that's something that we could definitely set up, and she could help to train alongside Kathy, and then she could also attend the Train the Trainer webinar. So it's watching like an hour-long webinar that Kathy taught and then recorded. So then she would have access to all of our materials, and she would be able to continue doing the 4-hour training, which is great because then, you know, when you hire new staff, you have a person away that you can train them on these 5-hour clinical skills.
Can I ask a question?
Yeah, certainly.
All right. When Kathy taught us in the 4-hour training, she mentioned housekeepers and that a housekeeper had kind of been one of the reasons why people were breastfeeding, and then the nurses would come back the next day and then they would suddenly have changed to bottle, and they kind of pinpointed it down to a nighttime housekeeper. What kind of training do you suggest we do for that kind of staff? Because I do have a housekeeper that have one morning and night on my floor at all times.
Great. That's a great question, and we're going to get to that a little bit later in the workshop. But that's the group of staff where the facility determines what education that they're required to do, and Kirsten's going to go over some options a little bit later in the workshop.
Okay.
Great. Awesome. Okay, so if there's no other questions at this time on the 5-hour course, I'll move on to talking about doctors and midwives, your advanced practice nurses, and their education requirements under Baby Friendly USA. So again, this is going to be, this is section B of your CHAMPS clinician training plan. So if you want to look at that and start jotting down some notes now, it would be a good time. If you have, hopefully we'll generate some ideas about how you could get this group of staff trained. So under the Baby Friendly guidelines, doctors, midwives, and advanced practice nurses, they need to complete 3 hours of training. So there's, again, it's kind of similar options for training them. You have your in-house option. So this is an lactation expert on staff teaching the physicians, and external training options. So for an example, they could attend the CHAMPS 4-hour training, your doctors, and that would count for their 3 hours of training. They would meet that requirement probably and then some. So that's another good option. There's also an online option for training. So there's some different online training options. The one that CHAMPS recommends is the Northeastern training, and I'll talk about that in more detail a little bit later. So the actual requirements for this 3 hours of training, they're fuzzy. They don't outline, Baby Friendly doesn't outline them like they do the nursing training. So there's not, 15 topics and objectives for each of the topics for these physicians. So Baby Friendly just says that the 3 hours of breastfeeding management education needs to be pertinent to their role. However, I just want to note to you guys here right now that doctors and RNs, they have to answer the same questions when it comes to Baby Friendly coming and assessing you. So even though nurses get 20 hours of training and physicians are only required to do 3, they still have to answer the same questions. So let's see. So here's just an outline of kind of the CHAMPS resources that we offer for your doctors meeting their 3-hour requirement. So the first resource is a free online course that's offered through Northeastern University and Community Health Training Institute. So the 3-hour course is divided into 2 1.5-hour training sessions, and doctors can complete these online, and then when they complete them, they earn CMEs and they get a certificate of completion that you would then collect from them and keep on file so that you have proof that they completed their 3 hours of training. So I have the links here to the 2 trainings, and then when you get the PDF of these slides, you'll be able to access the links. And again, there's also another CHAMPS resource is the CHAMPS 4-hour clinical skills training. So if you have your physicians attend these trainings, they would fulfill their 3-hour requirement as well at that time. And that's nice if doctors you can't get them to do the online training, maybe you can get them to attend this 4-hour clinical skills training. I know Angie was successful in getting some of her doctors to attend the training, and I think that they really enjoyed themselves too. So that could be a good option as well. Okay, again, just planning, trying to think about some next steps for how you could get some of the doctors to do your training. So again, think about, do you have doctors and midwives and advanced practice nurses that would like to attend a CHAMPS 4-hour training? That might be a good option. I think, Angie, correct me if I'm wrong, but I think you just told doctors that it was a requirement that they attend. How did you get your physicians to attend the CHAMPS 4-hour training?
Girl, you have to tell them that. You have to say you have to do this. Of course, the Blue Cross thing was very helpful in getting me to, dollars and cents. And so we have recently purchased our pediatricians' offices, and so all of those are hospital-owned now. And I said, you just got to roll with the plan, and having your CEO to support you was really, really very helpful in that. So, yeah. But one of our obstetricians did come, and he learned a lot. And he was probably the biggest clown in the class and enjoyed it and kept everybody laughing. So it was really an eye-opener there, too.
Oh, good. So, if you can get your doctors to attend the CHAMPS 4-hour training, or maybe there's not a 4-hour training that's happening near you soon, the online option is another option. It's free. Physicians earn CMEs. So just ways to think about how to get your doctors to do that training. I know we've talked to people in the past, and they have told us that it's really helpful if, instead of just sending out a mass email, of saying to all of your physicians and say, here's this training opportunity, people have really felt that it was more helpful if they went and they talked to each physician individually beforehand and kind of prepped them and said, you know, like, I'm going to be sending this training opportunity. It'd be really great if you could do this. You know, it's 3 hours, you earn CMEs, like, be on the lookout for my email. And they felt like that was, they had more of a positive response after doing that. Does anyone else have an experience that they want to share, or any ideas for how they could get their physicians to complete their 3 hours of training? Okay, we'll move on. This is another one of those pop quiz slides. So these are some examples of questions that Baby Friendly would ask, you know, when you're being assessed, when they visit. So they're going to assess, again, they're going to assess your staff's education and their knowledge of breastfeeding and best maternity care practices. So some of the questions they could ask are, name 3 reasons why skin-to-skin is important. They could ask, when should skin-to-skin begin? And then they could also ask, how long should it last? So we just want you to think about, you know, if every one of your nursing staff who comes in contact with patients, moms and babies, would be able to answer these questions accurately, and if every physician would be able to answer these questions accurately as well. And so one of the goals of the after you do educate your staff is you want to make sure you kind of assess their education level too, and ask these questions to make sure that they didn't just click through the online course and not really learn anything, just kind of go through the motions. You want to make sure that they really did take in the information and learn all of the skills that you want them to learn. Okay, so I'm going to pass the ball over to Kirsten, and she's going to talk about that other staff requirement under Baby Friendly USA.
Perfect. Thank you, Laura. And I just really quickly wanted to point out, too, I didn't want to mess up the order too much, but just on that previous slide, that should say 3-hour training for the doctors. It says that down below, but I just wanted to make sure. The 5-hour training is for the nurses, the 3 hours is for the doctors.
Oh, thanks, Kirsten.
Yeah, no worries, no worries. So just really quickly here, Angie asked a great question about other staff before. And as Laura said earlier, there is this whole section of other staff who do not have specific requirements for training under Baby Friendly USA, but Baby Friendly will ask you, you know, what kind of training have you done with your other staff? And at that point, you'll want to have, you know, a little something that you can show them that you've done with your different staff. So if you refer to that clinician training plan in section C, there's a nice table there that can really get you starting to think about the different departments and different staff that might need additional training. And they can all have different types of training. So in some hospitals, CNAs, for example, aren't doing a lot of patient care, direct patient care. There may be the ward clerks. I'm sorry, ward. I worked at a hospital where we called it the ward. I don't know if you guys will call your inpatient department the ward anymore. And some CNAs in some hospitals have more of a hands-on role. If those CNAs in your hospital have a more hands-on role and are interacting a lot with patients and expected to do some of that patient education, they might need, for instance, you might want them to do all 20 hours of that baby-friendly requirement that the nurses are doing. Or you might think, no, if they just did that 5-hour clinical competency training, that would be sufficient for their role in our hospital. The same could be said for dietitians. Some hospitals have very active dietitians who are doing a lot of patient education around breastfeeding. Others don't. So you just can gauge the needs by your own hospital. Some of these people as staff, for instance, like lab techs, they might not need really any of that training that the nurses did. like the clinical competency or the didactic training. They might just need to understand rooming in and why rooming in is important and why we're going to do routine blood draws in the rooms now versus taking babies out. And what instances are acceptable for taking babies out of the room to do those blood draws. Pharmacists, they might need some additional training on the types of medications that are compatible with breastfeeding. Your housekeeping staff, you know, maybe all the training they need is just to know that, you know, to try to be respectful of the times when mothers are nursing and to not go into rooms in those times, or not to comment on breastfeeding or bottle feeding. Whatever you think is necessary in your hospital. Security might need to know where the pumping rooms are and need to know the rules of your hospital around if they see a mother nursing in the lobby, but that is absolutely fine and acceptable, and they, you know, they shouldn't be commenting to that mother at all. So it's really up to you and the scope of work for each of those staff in your hospital. So you can start thinking about that now and kind of outlining who might need additional training. All of these people will also need orientation to your infant feeding policy when you do go for baby friendly. And so a lot of times we'll recommend that you pair those together. So you say to your dietitians, okay, we're now going baby friendly. I need to orient you to this policy, and this is the training that you're going to need that is on top of that. Does anybody have any questions about that other staff requirement at this point? Angie, did that answer kind of some of the questions that you had before?
Yeah, that's great. And I never even thought about the security guard, but you're absolutely right. So that was good information. Great.
Okay. And we left a couple other blanks down on that table because you just never know. I mean, this is kind of our comprehensive list so far, but, you know, there are really a lot of people who work in hospitals and interact with moms and babies. So whatever is applicable to your hospital is really up to you. Does anybody have any questions about that? Any ideas of ways that they would like to take on this training right now, or questions about how other people have done it in the past?
I have a question, but it's not related to the education.
Okay.
This is Bridget at Gulfport Memorial. I don't know with the people who are on the telephone if they have much experience as in taking care of the mom laboring and labor and delivery before she delivers. I'm curious because we don't want the babies to get cold, and we're needing to turn up the temperatures in the rooms to kind of make it a warmer environment for whenever the baby's born, even though the skin-to-skin is supposed to help with the thermoregulation. What temperature and at what point are people making the change in the labor rooms? Can anyone answer that?
This is Michelle from Sodom Memorial. We don't really change the temperature. As long as baby's skin to skin, we do like wipe the baby off right before we put the baby skin to skin. Of course, not their hands, but we don't really change the temperature.
Our rooms are kind of cool.
Ours are really cold too, so as long as baby, we put a blanket over mom and baby, a warm blanket. As long as they stay skin to skin, their temperature is pretty good.
Okay. That's good to know.
That's what we do as well.
I'm sorry. We also check their temperature while they're doing, you know, skin to skin too, and it's always pretty good.
Okay, well that's good information. We did skin to skin this morning, and that baby was cool. So it went over to the transition nursery to go underneath the warmer. But I'm glad to hear that people who have more experience in the skin-to-skin than what we do right now are not running into that problem a lot.
Like that, just put like a warm blanket over mom and baby, and the baby should stay pretty warm.
Okay.
Perfect. Thank you so much, ladies. That's a perfect conversation to be having here. Definitely throw out those questions anytime you have them. And then we're going to move really quickly. We've kind of gone over this already, passing the test. You're not only going to have documentation that all of your staff have done this education, but all of your staff are going to have to then be able to show that they have the knowledge when Baby Friendly actually asks them, sits down and interviews them and asks them these questions. So here are a few more questions Baby Friendly asks. 3 reasons why it's important for every mother to be able to hand express. And how often should mothers with a baby in the NICU be advised to express their milk? So those are just 2 more questions that every single one of your staff are going to just need to be able to rattle off. When you get to the dissemination phase of Baby Friendly, you're actually given all of these questions so that you can prepare. Okay, and we are kind of running short on time, so we'll make this pretty quick. And Laura, I can't remember here. Okay, I'm still doing this. So guys, there should have been also an Excel spreadsheet that was in the email with your clinician training plan that Laura sent you. And so this Excel file is very similar to the one that Baby Friendly gives you when you get to the development phase. And it's the one that they want for you to, it's like the styles that they want you to use when you're tracking your staff education. So you can use our sheet here that we created. Ours is a little bit different. We feel like we've improved it. And so you'll see you've got an area there over on the very left you put down every staff member that needs to do the training for your nursing staff. And then there is a column there that you can mark when they've been oriented to your infant feeding policy. And then when they finish their 15-hour, and the pink is when they finish their 5-hour, and it will tally down at the bottom so that you can see your percentage of staff who have been trained. As you continue to go right, there's like an optional, like as it turns blue again, optional detailed components. So if you were to do in-person training for those 15 hours, and maybe you're going to do 3 hours of training today with a group of nurses and 5 hours next week with that group of nurses, you could keep track the specific topics that you cover on those specific dates. We've got them all there for you if you're doing it sort of piecemeal. If you're doing like an online version where it's like you just work through and then you have a complete date, that's where you can use those columns further over to the left, those the ones that do not have optional marks beside them. There are also tabs there to keep track of your staff training, or to keep track of your physician training. So there's the nursing staff tab, and then the physician training tab, and then the other staff tab. So you can keep track of all 3 of the different training cohorts. Continuing on quickly.
Yeah, and if you have any questions, like if you open up that Excel file and you have so many questions about what's going on, just give Kirsten and I a call. We can get on a call with you, and we could like share screens with you, and we can go through what we had in mind. So yeah, don't be afraid to call if it doesn't make sense to you, because we want to make sure that it's a useful tool.
Absolutely. Great. Okay, and then continuing education. So let's say you get to the point where you've gotten all of your staff trained, and I know, guys, this is like a ways down the line because you haven't really started your baby-friendly pathway officially, but just so that you know, there is no requirement for doing continuing education at this point in time for baby-friendly. So once you have successfully done the training with all of your nursing staff, all of your physicians, all of your other staff, and you have a good plan in place for ensuring that all of your new employees are adequately trained, there is no, like, 2 years later, you need to do an update. None of that is actually required, but it's a really good idea to keep track of it. And so here we've just given you a couple of ideas for ways that maybe you could continue to do some of that continuing education with your staff. Okay, and then we'll just go straight into, this is our final slide, and Laura's going to kind of walk us through next steps and planning the next workshop.
Great. Thanks, Kristen. So yeah, we just wanted to kind of end today's workshop just to think about who is planning to work on staff education over the next 3 months or maybe the next 6 months, but just who is planning to work on it soon. And then if you are one of those hospitals, we would love to see your CHAMPS clinician training plan when you fill it out so that we can just review it and then answer any questions that you have. We hope that it's a tool that you can use that will help you to think about your plans and to help develop your plans. So after the workshop, once you've filled out the clinician training plan, definitely send it to Kirsten and myself. And we might remind you prior to the next workshop to submit those plans to us. So yeah, so about that next workshop, we have set the date for May 19th at 11 a.m. And the topic is going to be rooming in, and it's going to be about the things that you can do like today to start moving towards rooming in. So it's all those little tasks that your nurses, or the little assessments that your nurses do, that they might be doing it in the nursery now, but they can easily be moved to the rooming in. So doing in the room with mom. So we'll be going over those on our next workshop. So does that date not work for someone that you know of already? That date definitely won't work? Okay, I'll take silence as the date probably works for most people. Again, if it ends up not working out for you, we'll record that workshop as well. We can send a recording. We'll send you the slides. So hopefully you'd be able to then view it afterwards. Okay, great. So I will be sending out, after the workshop, I'll be sending out the slides and a link to the recording of the workshop. And then I'll also send out a calendar invite for this May workshop so that you guys can all put it in your calendars, today, so that you can set that time aside to join us in May. And again, if you have any questions in the meantime, please don't hesitate to reach out to me or to Kirsten, over email or over the phone. We're always happy to talk to hospitals and to hear what's going on and to help you troubleshoot anything. So if there's any last-minute questions, Kirsten and I can stay on the call and answer them. Otherwise, have a great day, and we'll be in contact with you soon.